Good evening. Hello.
Yes, good afternoon,
Hi, caller.
ladies. How you doing?
Good.
Just a few quick comments. Number one, Joe, I'd rather have insurance than not to have none. If I was walking down the street and fell out and it was a veterinarian shop, I'm going to go in there. There's too many people that don't have insurance. We need to have insurance. And, Joe, you mentioned pharmaceutical and research. Those are two different entities. Now, the pharmaceutical people is the one that's controlling that. But let me tell you, Joe, it was a time, and even with research, it was a time humans didn't live to nothing but 20-something years old. I just read in the paper, was it today or yesterday, they said by the year 2020 or 30 or something like that, the average lifespan going to be up close to 90 years old. Joe, that's from research. That's from medication. It's a good thing, man, that everybody got a chance to get to the hospital, because there are many people don't get the opportunity to go.
But what I want to say, and I'm trying to stick to point, is we all have valid concerns. We have valid arguments. All of us, those of you who are calling in, those me and Pam who are sitting here. The point I want to make is that there are 60 people, there are 100 people in the Senate. 100 men, of only one is African American, and that 100 people are going to decide what our future is going to be like. My concern is that we all know how important it is at this juncture to call your state senator. Either you're for it, you're against it, whatever, and let them know how you feel. This is your opportunity to do that. Learn as much as you can and then give them a call. Hi, caller. Hello.
Yes. Hello. How you doing?
Good. How are you?
All right. I just wanted to say that first, do you think the flu shot that's being implemented in our community, especially our states, because I kind of think back to the Tuskegee things, and I think it was something that's supposed to have been helping them health-wise, and it turned out to be, a bomber. But also I want to know is that with this health care plan being pushed and you guys saying the Democrats got to drop the public option, then I question, then if you dropping the public option, then what you putting in place to make the people feel it's safe, because a lot of people, especially in the lower communities, go look at that as really you turning your back. You know what I mean? You going for something else just to get one vote.
And guess what? This is what I want you to do. Get the number for your senator.
I know my state senator.
Okay,
not state.
No, not state. United States. Your United States senator.
Senator Durbin.
Senator Durbin and Senator Burris. One of those two. They are the ones who are having the vote on this, not your state. Give them a call. Ask them that question. Let them know what you think. It's important.
I do ask them that question, and it's like they fall on.
You mean Durbin? You've talked to Durbin and Burris?
I can't never get in contact with
him. Let me just say this. Could I just say this, caller?
Same usual.
Leave a message.
Let me just say this. If you have access to email, you can also email them. They do respond to our emails. I've done it numerous times. And it isn't that I don't think, my personal opinion is that we need the public option. And I don't think that Democrats are dropping it because they want to drop it. It's more of a pragmatic issue. And what you asked what they would have in place of it, the proposal is that people starting at age 55 could sign up for Medicare, could buy into Medicare, and now Lieberman is saying he's against that when he was for it before. And the other is that you would have access to the same insurance plan that federal employees have, and it will be administered by the Office of Personnel Management.
The thing is, and let's take this last caller. Good evening, caller.
If you go back towards the Nixon administration, he the one who really changed our health care policy. When the insurance companies started being much more
I understand that,
profit.
and I'm going to interrupt you because I'm still on point. The point is,
but
you and I can talk all that we want to, sir, but unless we let those people who are deciding this know how we think, they will decide what they want to. Then it will be left up to us to complain about it afterwards like we always do. And I'm trying to turn this around to say we need to call them up and say, I'm for it, I'm against it, this is what I want to see in it. When you make that vote, this is my vote. and let them know.
Do you
Please.
disagree with what I say? It was Richard M. Nixon that changed our health care system around. They turned it around.
What's that got to do with voting today?
He turned it around where insurance company was able to make these high rates.
What does that have to do with them voting right now? Right now, they're voting, and they're going to change your health care.
The interesting point about Nixon, though, the interesting point about Nixon, though, is he's the one who introduced the whole HMO situation. He was trying to get some universal health care. And let me just say that presidents all the way back from Roosevelt.
No, he
and Teddy Roosevelt. I'm not even talking about Franklin Roosevelt. Presidents all the way back from Teddy Roosevelt have been trying to get universal health care in America. Every single one has failed. We are the closest now in this administration than we've ever been to getting health care coverage for all Americans. And we will be nuts to not support health care reform.
And the interesting thing about it, Pam, is that the party of the no is very consistently on one page, no matter what. The thing that makes us angry and that we need to talk about with our representatives, from the council to the state legislature to the United States Congress, is the fact that we are constantly being put on the bargaining table, our welfare, our health, our well-being, on the basis of politics and special interests.
Absolutely.
And every single one of them, I cannot think of one of them, and there may be one, who is not in some part been contributed to by these very insurance companies that they are trying to rein in. They're not trying to get rid of them. They're trying to rein them in. They're trying to promote honest, bargaining, competition, whatever, and that brings our price down. And that's the bottom line.
Exactly.
And I want to skip over everything else because we're at the very end of this whole debate. And I don't want to hear it after it is done, if it is not done to your satisfaction, unless you can say to me, when you call here after this bill is passed, I called my congressman, I called my U.S. senator, I made my preference known, I told them that. They didn't do it. Now then we can talk about what we can do about that.
It's a good point that you brought up about the whole problem of money in politics.
Yes.
You know, Senator Lieberman's nickname is the senator from Aetna.
His wife works for an insurance company.
Well, she works for a lobbying firm.
The lobbying firm,
whose
that's
clients
right.
are mostly insurance companies and drug manufacturers. And, you know, it's kind of like what President Obama said. If they say that, well, the government can't run insurance and the government messes up everything, then what are you afraid of then? Of a government-run public option. If it's so bad, then won't anybody sign up for it? But see, logically, they know that if I have a choice between a public insurance option that is going to give me the same benefits and it's lower cost than one of these from any insurance company, then I'm going to pick that. And the insurance companies know that. And it's going to be, recently too, Aetna raised their rates, and it ended up 650,000 people are at risk of losing their coverage because they're going to make it so expensive that employers aren't going to be able to afford it.
Yeah. So that's
so that they can keep their profit margin, pay their CEOs, have all the golden parachutes, and all of those things.